The respiratory system involves the exchange of gases between cells, blood and the atmosphere. Types of respiration: pulmonary ventilation, external respiration, inspiration, expiration. External respiration occurs in the lungs. Internal respiration occurs in the tissues: nose, pharynx, larynx, trachea, bronchial tree, lungs. Organs of respiration: nose, pharynx, larynx, trachea, bronchial tree, lungs. Nose moistens, warms, and filters air, houses olfactory receptors. Serves as resonating chamber for speech. Nasal septum divides nasal cavity. Palate serves to separate the nasal cavity from the oral cavity. Hard palate, soft palate, uvula. Pharynx, nasopharynx, upper portion, region above the soft palate. Oropharynx, middle portion, area behind the oral cavity. Laryngopharynx, lower portion, area below the epiglottis. Larynx functions to prevent food or fluid from entering the respiratory system during swallowing and allows airflow during breathing. Production of sound is secondary function. Larynx: unpaired cartilages, thyroid, cricoid, epiglottis. Paired cartilage, arytenoid, corniculate, cuneiform. Vocal folds, glottis. Trachea: tube-like structure leading from the larynx to bronchial tree. Consists of smooth muscle and C-shaped hyaline cartilage rings, lined with pseudostratified ciliated columnar epithelium. Mucociliary escalator. Bronchial tree includes a right and left primary bronchus which divides to produce secondary bronchi, tertiary bronchi and bronchioles. Terminal bronchioles branch into respiratory bronchioles which divide into alveolar ducts that connect to alveoli. Alveoli, functional unit of the lungs where gas exchange occurs, 300 million. Thin walls made of simple squamous epithelium. Type I and Type II alveolar cells. Diffusion of gases takes place across an alveolar capillary respiratory membrane. Lungs: paired organs in the thoracic cavity. Right lung, 3 lobes. Horizontal/oblique fissure. Left lung, 2 lobes. Oblique fissure. Apex/base. Hilus. Pleural membranes: parietal, pleuravisceral, pleura-pleural cavity. Pleurisy. Pneumothorax. Physiology of respiration. Pressures: atmospheric pressure, 760 mm Hg. Intrapleural pressure is always less than atmospheric and alveolar pressure. Alveolar, intrapulmonary pressure changes with phases of breathing. Pressure changes in lungs are produced by variations in lung volume. Boyle's law. The pressure of a gas is inversely proportional to its volume. More volume, less pressure. Less volume, more pressure. Inspiration, expiration. Alveolar pressure is below atmospheric pressure due to increased volume. Air flows into lungs. 760 versus 758 mm Hg. Alveolar pressure is above atmospheric pressure due to decreased volume. Air flows out of lung. 762 versus 760 mm Hg. Respiratory air volumes. Tidal volume. Inspiratory reserve volume. Expiratory reserve volume. Vital capacity. Residual volume. Spirometer. Regulation of respiration. Medullary rhythmicity center, medulla oblongata controls basic rhythm of respiration. Control centers in the pons. Pneumotaxic center inhibits inspiration. Apneistic area stimulates inspiration. Gas transport. Oxygen transport. 98% of oxygen is bound to hemoglobin as oxyhemoglobin. Each hemoglobin molecule has the capacity to bind with 4 oxygen molecules. Hypoxia. Factors affecting hemoglobin saturation. Partial pressure of oxygen. Increase PO2, the greater the percent saturation. pH. In an acid environment, O2 splits more readily from hemoglobin. Temperature. The higher the temperature, the more oxygen released from hemoglobin. Carbon dioxide transport. 70% of CO2 is transported in the plasma as bicarbonate ion. 23% of CO2 is bound to the globin part of hemoglobin as carbaminohemoglobin. 7% is dissolved in the plasma. Respiratory disorders. COPD, chronic obstructive pulmonary disease. Asthma. Bronchitis. Emphysema. Lung cancer. Tuberculosis. Cystic fibrosis. Cheney-Stokes respiration. Pneumonia. Sleep apnea. SIDS.